The following clip contains information relating to COVID-19 and COVID-19 patients and may be a trigger to some. Sensitive viewers are advised not to continue.
The following is an interview conducted between two junior healthcare workers from South Africa during the time of the third wave of the COVID-19 pandemic. Breathless is an initiative to highlight the challenges, struggles, and experiences of a frontline worker serving during these times. We hope that by hearing these experiences, you will gain an understanding and appreciation for our frontliners and will be motivated to adhere to non-pharmaceutical interventions such as keeping distance, washing hands, sanitizing, and wearing masks. The interviewer is Dr. Kapil Narain from KwaZulu-Natal. The interviewee is a healthcare worker in Gauteng. Their identity is kept anonymous for their protection so that they may openly speak about their experiences and challenges.
Hi Doc, thanks for joining us today. Please could you introduce yourself?
Good day. My name is I'm a medical intern at hospital.
The National Institute for Communicable Diseases reported 18,762 new COVID-19 cases in SA over the past 24 hours. This represents a test positivity rate of over 25%, meaning 1 in 4 patients are coming back positive, with Gauteng accounting for majority of cases, 63%. There's also been an increase of 606 hospital admissions in the past 24 hours. Please tell us, what is the situation on the ground?
The third wave upon us wards are full. Some wards had to be converted into COVID wards. Bed capacity sitting at a maximum. Our restrooms are full. People on oxygen. So it is quite hectic now because numbers have increased, which means that more people are coming in with respiratory-like symptoms, and that definitely is an indication, or rather we tend to suspect that could it be COVID, which means that more people now are sitting in our PUI wards, and even in that, more of those people in the PUI wards are now testing positive, which means that they need to now be transferred into our COVID wards, which means that bed capacity sitting at a maximum, to a point that, especially since we're still in the process and we're on an upward trend, means that there is definitely going to be a need for more beds.
That sounds intense. If you could put down the situation to one word, what would it be?
Disturbing.
And have your seniors, your medical officers, registrars, consultants, have they been supportive in this time?
Of support, I think where I'm working, definitely the seniors have been quite supportive. They too have been overwhelmed by the situation, which means that it's a team effort from both the interns and the seniors in order to get through the patient load, to get to see the patient, especially at the same time knowing that as much as there is COVID, there's still patients with other medical conditions that also need our attention.
Now, describing the situation there on the ground and these challenges that you face, do you feel that your hospital management is doing enough? Do you feel government is doing enough?
I think in terms of hospital management, they've tried to assist accordingly, making decisions in terms of converting certain wards into COVID wards, PUI wards, and I think that has been quite helpful at this current moment, but I do feel that more decisions need to be made at a rapid rate because of the increasing numbers as well. In terms of the government, I think, the support hasn't been that much because you know that a third wave is upon us, and there's a need for making sure that hospitals have the capacity as well as health workers are equipped, because we are human after all, and fatigue does set in, which means that at a point if health workers do get sick, then it's going to be an issue because already the health workers that are currently in the system are overworked, systems are understaffed. So I think there is room for improvement in terms of what already is being done by government as well as hospital management. We do appreciate the efforts, but there is definitely going to be a need for more support and more to be done, especially as we're in the third wave.
How have you been coping during this period? Have you been coping?
Well, I think in terms of coping, I think the biggest contributing factor is team efforts from seniors as well as colleagues that I think helps with the burden, the load, and personally I have been coping as much as it does get hectic, especially on calls now at this current moment. I think we are still coping, however fatigue does set in, but overall I think I am coping.
And finally, what is your message to the public?
The big message to the public is to follow all protocols that have been put in place, to continue to wear a mask in public, to continue to avoid overcrowded places. I think the best thing to do during this time is to treat it as if it's a hard lockdown. Do what you need to do. If you need to go out, but try and limit going out into overcrowded places in public, because that's where the big risk is, because some people may be symptomatic, some may be asymptomatic, so you never know who you're coming across, and you then come home and then you could possibly infect those at home. So I think it's important to continue to wear a mask, follow the protocols, listen to what is being said, because I think we need to work together. How the wave turns out will be how well we work as a people in the community. I think we just need to continue to take things seriously, don't let our guard down, and just to continue to follow what the government has put in place, as we know that we had a second wave which was hectic as well. But I think now we got 2 waves before we have learned, and I think we just need to continue doing what we are told and take it seriously.
Thanks, Doc, for sharing your time and experiences as a frontliner at the third wave of the COVID-19 pandemic at a hospital in Gauteng. It is greatly appreciated. For those listening out there, if you enjoyed the video, please like, share, and subscribe. And let me know if there's anything I can do to improve. It'll be greatly appreciated. For my fellow healthcare workers out there, please be safe. I salute you. I salute all of your efforts. We will get through this. If you'd like to share your experiences through this platform, please let me know.
Thank you for joining us for the first episode of Breathless. We pay tribute to all those who have succumbed to the virus.